Will be the last. This will be the last sessions of A4M Thailand 2017. For some of you who are the Fermanagh guests, okay, welcome to the part of A4M Thailand. And when you see the glimpse of it, that how we've done. And for some of you, or most of you who already stayed with us from the first day until today, thank you so much. I hope you see that anti-aging medicine is scientific. Anti-aging medicine is not a quack science like somebody tried to tell you. And we provide you with a lot of scientific data. We like to thank our sponsors. We like to thank our speakers. And we like to thank our delegates. These sessions is sponsored by Fermanagh companies, which I am so appreciate that. They put an effort to make the supplements more scientific and reliable and trustworthy. Today, we have an honor to get Dr. Jeffry Michael Strong. He is the American born in Seattle, but somehow I think he lived in Japan. He's a naturopathic, well, now you know my age, right? People keep coming and ask about my age. Okay, he's a naturopathic physician trained in primary care medicine and special interest in complementary and alternative medicine. Especially the one that he will talk about today is a pycnogenol. He is fluent in Japanese. He's currently serving as a Director of Scientific Communications for Asia region and Japan Country Manager for Hallmark Research. So, we have scientific research for supplements, but better yet than drugs, because supplements produce much less side effect or none at all. And besides, the supplements can give you more than one benefit or for one disease. So, I'd like you, all of you, to give a warm welcome for Dr. Jeffry Michael Strong. And his topics today will be the nutraceutical and the role in health and beauty. Welcome, Dr. Jeffry Michael Strong, please.
Well, here we are for round two. Sawadee-kap. I can do this one in Japanese if you prefer. Nihongo de yarimashou ka. No, that might be boring. So it is my extreme pleasure to be back here again, and thank you, Dr. Pratana, for the kind introduction. I have left some material out just for this talk, so those of you who were in the earlier session will have something new to learn about pycnogenol. For those of you who were not here, I'll review the beginning here and give you an introduction to pycnogenol. Pycnogenol is a natural plant extract that is derived from a specific species of pine tree, the French maritime pine tree, which grows only in the south of France. It was originally developed as a pharmaceutical for treating cardiovascular conditions. In 1967, it was first launched in Europe. And for the last 50 years, this being the 50th year, pycnogenol has been available worldwide as a pharmaceutical or as a health food supplement. Pycnogenol is a standardized extract, standardized to the procyanidin content. Produced in a dedicated extraction plant under GMP conditions. In addition to the procyanidins, pycnogenol has other active compounds, including free catechin and epicatechin, taxifolin, and many different organic acids. And pycnogenol has been fractionated and studied for the most useful part. And guess what they found? It works best as the extract itself. Not the parts, but it's the whole that works the best. And pycnogenol is found in the United States Pharmacopoeia, where the USP distributes pycnogenol as their reference standard. Related to safety, again, it's still used as a drug today, so it's been studied as a drug for toxicity and been found to be extremely safe, and this is proven out in the many clinical studies. Regulatory-wise, there are 11 OTC drug registrations in the world, beginning in Switzerland, where it's sold as a drug, and then in Central and South America. In Australia, it's approved by the TGA. And then in Korea, there are 3 health claims approved for preventing blood clots and improving blood flow. as an antioxidant, and then also for the treatment of symptoms of menopause. And really, the efficacy of pycnogenol is proven in the abundant research. More than 135 clinical trials have been published with more than 12,000 patients. And in the beginning, it was all heart, but now, over the last 50 years, the research has really spread into many different areas due to the many actions of pycnogenol. And you can find this research available on PubMed, more than 400 peer-reviewed articles here, just by typing in pycnogenol there. What does it do? It has many actions that support really the key cornerstones to human health and wellness. And this makes it very good for anti-aging, but it also is a natural treatment, an alternative treatment for many conditions. It's most well known as an antioxidant. As a natural plant extract, it is one of the most powerful water-soluble antioxidants available. In addition to this, it has anti-inflammatory action, where it can decrease or inhibit the activation of NF-kappa B to begin with, also decrease the genetic expression of COX-2, and it directly inhibit the enzymes COX-2, 5-LOX, MMP enzymes, etc. Point 3 is the original reason why it was developed as a pharmaceutical, and really the reason why it is still used today as a pharmaceutical is that it enhances the function of the arteries while also strengthening the veins. Part 4 is that pycnogenol stimulates new and more collagen generation and also hyaluronic acid. And this can have great benefits for skin health, but also other tissues like the joints. And I will talk a lot about this today. And then lastly, pycnogenol also helps with blood sugar control by inhibiting alpha-glucosidase. And there is pharmacological data studying and identifying the key metabolites in pycnogenol and measuring those in the bloodstream of humans taking the product. You can see, though, that the concentration is relatively low in the serum. And so this posed a big question to us, is how can we have such a benefit in so many things, actions, with this low of concentration in the bloodstream? And so the research team at the University of Würzburg, who pioneered this, went further to identify and follow these metabolites of pycnogenol in the body. And they found that the GI flora plays a big part in producing these valorolactone metabolites of pycnogenol. And then further, that these valorolactone metabolites are very similar in structure to the glucose molecule, and so the GLUT1 transport proteins will selectively and actively take them up and import them into the cells and many different tissues in the body, including the red blood cells, white blood cells, and the neurons themselves. Even the blood-brain barrier has GLUT1 transport proteins on it. And so you can get this tissue-specific effect with the metabolites of pycnogenol accumulating in different tissues to restore endothelial function or to decrease an overactive immune system. And as an antioxidant, pycnogenol has been studied abundantly with basically any test method you could try. This is a clinical study done with healthy volunteers, but they have high levels of free radical stress because they are smokers. Divided randomly into two groups, given 50 milligrams of pycnogenol per day, you can see in 8 to 10 weeks that their free radical level has dropped back down to 300, which with the DROM test method, this is considered the healthy level for free radical stress. And they're still smoking. So obviously it's best not to smoke at all, but if you must, please take pycnogenol. Then the action in the blood vessels, improving arterial function, is like this, where the metabolites accumulate in the endothelial cells, and they stimulate the enos enzyme to boost nitric oxide production. This ramps up cyclic GMP and causes smooth muscle relaxation and vasodilation. And then in the bloodstream, it also acts on the platelets to reduce the reactivity and decreases the risk of blood clots. So there are more than 30 different clinical studies related to various heart disease-related conditions, and they show that pycnogenol, through its vasodilating effect, can significantly lower high blood pressure. It has also been shown, though, to balance cholesterol levels, reducing the bad and increasing the good. inhibiting clotting, also restoring better tissue perfusion in the kidney and improving kidney function. And then what I will talk about today is the reduction of the rate of progression of atherosclerosis. So this is an example of a human pharmacological trial that was conducted at the University of Hiroshima at their medical school there. So very nice to be all hooked up here to many different things. The subjects were healthy volunteers, students who were given 180 milligrams of pycnogenol per day or placebo for 2 weeks. So very short term. At the end of 2 weeks, they were hooked up there, as you saw, for plethysmography examination, and they injected them with acetylcholine. And in the blood vessels, acetylcholine is a nerve transmitter to stimulate better nitric oxide production. And this is what they saw. So even the placebo group with the injection of acetylcholine saw a significant boost of nitric oxide. However, pycnogenol already does this, already ramps up nitric oxide production. So when acetylcholine was injected in these subjects, you saw a much more pronounced improvement of blood flow, 1.5 times greater than placebo. So very significant and pronounced action here. And the other thing they did in this study was they used an enos blocking agent and they stopped the production of nitric oxide. And when this happened, the effect of pycnogenol on enhancing blood flow completely disappeared. So we know this is exactly the mechanism by how it's working in humans. Then you may be wondering, many of you may have thought of this already, that enhancing circulation could have good effects for treating ED. And yes, it's true. And pycnogenol by itself can have this effect, but usually you need higher doses. If you combine pycnogenol with L-arginine, you can see this effect with a much lower dose of pycnogenol. L-arginine, of course, being the precursor for nitric oxide, and pycnogenol acting as the stimulant to the enzyme. And there is a patented formulation sold under the brand name of Prelox, which has this formulation with pycnogenol in combination with arginine. And there are multiple clinical studies on this, very well-designed studies, as a matter of fact. Double-blind, placebo-controlled crossover study here conducted with men with moderate to mild ED. They took 4 tablets of Prelox a day, so this is the equivalent of 80 milligrams of pycnogenol and about 3 grams of arginine. So here's the results, again in the double-blind crossover style. They used the IIEF survey of erectile function. Of course, this was developed by Pfizer for investigating Viagra, same survey. So can you guess which group was taking the active? Pretty obvious, huh? So it was very clear that when the patients were taking Prelox, that their erectile function scores improved dramatically. And they also saw a significant reduction in blood pressure in these patients. And there were no negative side effects reported. And this is published in the International Journal of Impotence Research in 2008. Moving on to atherosclerosis, of course, this is the holy grail of cardiovascular medicine, right? Stopping the progression of atherosclerosis. Well, with all the anti-inflammatory, antioxidant actions boosting endothelial function, you would think that pycnogenol would be good for this. And so there was a very large pilot study, more than 1,300 subjects involved with various treatment groups here. And it went on for 2.5 years to investigate this possibility. The treatment groups, briefly, a 50 milligram group, so the low dose, 100 milligram is the high dose, and then there was a group combining pycnogenol with aspirin at 100 milligrams plus aspirin, and then another group with pycnogenol combined with Centella asiatica extract, standardized to the total triterpenoid fraction at 100 milligrams too. And then there was a control group which was untreated, and then a normal treatment group with aspirin therapy and antiplatelet therapy. So these, the measurements done were at the carotid bifurcation or in the femoral artery at the bifurcation here. And all the subjects had identifiable plaques in the arteries, but these were non-stenosing plaques. So this is stage 4 in the scale of atherosclerosis. So identifiable plaques, but non-stenosing. Here's the results. After 2.5 years of taking these various treatments, you could see that control group, there was 21.3% of the subjects that had significant development progression of their atherosclerosis, whereas this was reduced to only 8.4% of the population with only 50 milligrams of pycnogenol a day. So very good even for this low dose. Upping it to 100 milligrams per day, you saw only 5.3% of the population had progression, significant progression. The platelet therapy was not so good. I mean, it was a little bit better than no treatment at all. Combined with aspirin, slightly better than pycnogenol alone. And by far the best result was the combination of Centella asiatica and pycnogenol. And it was really quite phenomenal, the result that they saw there. This was followed up by another study, even longer term. So this went on for 3.5 years this time, involving over 800 patients. But these patients had progressed further in their atherosclerosis, so they had stenosing plaques here. Basically the same treatment design as far as the groups. And again, these are stenosing plaques here, so fibroatheroma stage. So much faster progression of disease at this point, harder to control. And these are the results of 3.5 years. You can see that control, there was about half of the population progressed to the final next stage of atherosclerosis, where it was significantly reduced with only 50 milligrams, but the 100 milligrams was by far much more effective at stopping the progression of atherosclerosis here. Combination with aspirin was no real big difference, and then the Centella and pycnogenol combination actually worked the best here again. Looking further, in the second study, they looked at more data, so they actually looked at the ability of the combinations to prevent cardiovascular accidents, heart attack, stroke. And you can see that greater than half of the controls, they had these cardiovascular incidents of clotting or heart attack or stroke. And with the pycnogenol group of 50 milligrams, this also was able to significantly reduce this, but still a fairly high rate. 100 milligrams was even better, much more significant. But by far the best treatment, again, was the Centella combination with pycnogenol. So very, very significant combination here of these two natural extracts. And then the other thing that they looked at in these populations was the ultrasonic score. The sum of 4 of the bifurcations. So basically they're measuring the echogenicity of the plaques themselves. And the lower the score is, the more solid the plaques are, and the lower the risk that they will break free and cause a cardiovascular event. So you want this score to remain low. And you could see over 3.5 years, pycnogenol treatment, 100 milligrams was sufficient to keep the echogenicity score low. Aspirin combination worked a little bit better, and again, the best was pycnogenol and Centella combination. So really quite groundbreaking work in showing good evidence that pycnogenol can significantly slow down the progression of atherosclerosis, and really the root cause of heart disease. And again, they looked at oxidative stress in these patients. And here, pycnogenol by itself was quite good, but the combination with Centella was the best by far at reducing free radical stress. And there has been other research to further elucidate the mechanisms behind this action. Just published in 2016 in the Journal of Cardiovascular Pharmacology, showing that pycnogenol reduces toll-like receptor 4 signaling pathway-mediated atherosclerosis in mice. So this is even more depth into the mechanism behind the action of pycnogenol in reducing or stopping the progression of atherosclerosis. So the latest study is going for over 5 years now, and that should be published either this year or the next, with preliminary results are quite similar to what we've seen here. So the next area I'll go into a little bit more is related to blood clotting and decreasing the risk of blood clotting, abnormal blood clots. This particular condition is in the eye, and it is recurrent retinal vein thrombosis. This condition, once it happens once, it's very common to recur, and it is difficult to prevent once it has happened one time. Standard aspirin or anticoagulant therapy is not very effective in preventing the recurrence of this condition. So pycnogenol was investigated for this. There was 23 untreated controls, also a common watch and wait therapy. Pycnogenol at 100 milligrams per day, and then a group treated with aspirin for comparison at 100 milligrams per day. It was a 9-month study, and again, the goal is to prevent recurrence of the clotting incident. So the retinal tissue was evaluated for clotting and edema by optical coherence tomography, and it was very clear that pycnogenol by far was the best at preventing clotting from occurring again, with only 3.5% of the population having a recurrence, whereas the aspirin and no treatment at all group performed about the same, between 15 and 17% recurrence rate. And you can imagine that decreasing the recurrence of the clotting, also pycnogenol's ability to strengthen the blood vessels. You saw that only in the pycnogenol group was there a significant reduction in edema or swelling in the retina in these people. And there are many studies, more than 1,000 patients worth of studies related to pycnogenol in treating diabetic retinopathy, which is basically a condition of the blood vessels of the eye, where pycnogenol very significantly improved blood flow in the eye and reduced edema and improved vision in patients with retinopathy as well. Similar to this. So this afternoon, I talked about pycnogenol for strengthening blood vessels in the legs with chronic venous insufficiency. And you can see here that it can also work in other tissues, as in the eye. And then the second half of my presentation will really focus on the benefits for skin health and for beauty. And pycnogenol, over the last 20 years, there has been a lot of research related to this area, and still more that is going on. Now, the skin acts as our barrier to the world, protecting us against mechanical damage or chemical damage, invading bacteria, but it's also important for maintaining homeostasis in our bodies with the water regulation, moisture regulation, body temperature, etc. But it also has a big impact on how we feel about ourselves, psychological impact, emotional impact. As we age, and the changes in our skin can cause changes in the way we feel about ourselves, and perhaps make you less socially interactive, which in the end is not good overall for your health. So maintaining healthy skin and that you could feel good about your appearance is an important aspect, a health aspect as well. It's important to remember that topical is not the answer for everything, because of the skin barrier does not allow penetration of many compounds. So there's no such thing as a topical multivitamin mineral because of this. So it's important to remember to use active compounds that can be delivered to the skin and provide good benefit through the microcirculation. And again, pycnogenol is very good at this because it enhances the microcirculation to the level of the skin. And this has been seen in a study in Japan with only 60 milligrams per day in healthy individuals for 4 weeks, showed significant improvement in the microcirculation in 83% of the subjects. So significantly enhancing blood flow to the level of the skin, and therefore providing better nutrient supply, better oxygen delivery, and better waste removal of the skin. That by itself will make the skin better. But then again, there's the anti-inflammatory actions of pycnogenol, and related to skin turnover and effects in aging, pycnogenol inhibits the MMP enzymes, which are really involved in this turnover process, and pycnogenol also boosts collagen production. Therefore, you can have this rebalancing and anti-aging effect in the skin, slowing down the aging process. And even the metabolite of pycnogenol, these valorolactone compounds, have been shown to have a significant inhibitory effect on multiple MMP enzymes, helping again to decrease inflammation in the skin and protect the skin by decreasing the activity of these MMP enzymes. And then there is multiple studies showing how pycnogenol can prevent damage from UV radiation. So of course, when you have UV light hits the skin, it can penetrate the skin into the layers of the skin, and it can cause radiolysis. It can cause a significant increase in free radical stress. These free radicals, of course, can damage DNA, potentially increasing the risk for skin cancer, but also stimulating an immune response once the level meets a threshold, and then you have more MMPs in there, so you speed up the breakdown of the collagen. And in the end, the inflammatory response, and you're left with a sunburn. So there was a study conducted at the University of Arizona in Tucson looking at healthy volunteers where they used a UV lamp, and they shown on the arm, they irradiated the arm for the equivalent of 1 MED. So this is enough to cause a sunburn, basically. And they measured the amount of energy that was required to do this. You can see baseline without pycnogenol that the amount of energy required was relatively low. Then they gave them pycnogenol at a standard dosing regimen of 1 milligram per kilogram of body weight for 4 weeks. And then they retested, same lamp, same arm. And you could see here that simply by taking pycnogenol, there was a 60% increase in the amount of energy required to cause the same level of sunburn. So there was significant protection already there with this dose. Then they increased the dose here to 1.7 milligrams per kilogram of body weight for 4 weeks, retested again, and this time it required almost double the amount of energy to cause the same level of burn. So a significant protective effect. I wouldn't go so far as to say it's like an oral sunscreen, but it does have a significant effect in decreasing the negative damage caused by UV radiation. And again, this is the antioxidant, anti-inflammatory effect that we're seeing here. And as a result of this, as you may expect, it can reduce the risk of skin cancer. And this is a study, there are multiple studies in mice showing this effect. This is one that was conducted in Greece using nude mice, so hairless mice. Now, 4 groups. There were albino mice and regular pigmented mice, half eating pycnogenol, half not. And they were exposed to 1 MED of UV radiation every day for 5 days a week for 28 weeks. And you can see that the albino mice not eating pycnogenol had tumors as early as 5 weeks. And already by 8 weeks, 9 weeks, they had 100% of these mice had tumors. Those who had normal pigment in their skin, they didn't develop any tumors until 7 weeks because of the protection of the pigment. But already here at 10 weeks, 100% of these mice had tumors. Then the pycnogenol group, even the albino mice did not develop any tumors until week 13. And then even at the end of the study at 28 weeks, there were still 40% of the mice that did not have tumors at all. So a very nice protective effect was seen here. Pigmented mice, they didn't develop any tumors until week 15 here. And then by the end of the study, you can see again that there was a big percentage of the group, 40% of the mice did not have tumors at all, just simply by taking in pycnogenol daily in their water. So a very interesting protective effect here, reducing the risk of skin cancer promoted by UV radiation. And the other aspect of UV damage or stimulation is increased melanin production and skin spots, which is more of an appearance issue than it is a health issue. But pycnogenol has been studied for its ability to decrease melanin production. This was a study conducted at the University of Busan, and in vitro study, but they saw a significant dose-dependent effect of pycnogenol on inhibiting the activity of the tyrosine enzyme, decreasing significantly melanin production. And in this study, they compared it to a common whitening agent known as kojic acid, and pycnogenol was seen to be 4 times more effective at inhibiting tyrosinase than kojic acid. And this really supported an earlier finding in a clinical study which showed that women taking pycnogenol had a significant reduction in the size of their skin spots. So these were 30 women who had skin spots due to melasma, and they were given 75 milligrams of pycnogenol for 4 weeks. At the end of 4 weeks, they had a significant reduction in the appearance of the skin spots, so a lightening in the color, as well as a nearly 40% reduction in the size. So very significant benefit here through decreasing melanin production. And just published in 2015 was another study that really dove into more detail on the mechanism of action in pycnogenol and preventing melanin production. This study, conducted in Germany with 20 healthy women between the ages of 55 and 68, taking 75 milligrams of pycnogenol per day. So at the baseline, they again subjected them to UV radiation here, and then they took a biopsy of this spot, and they looked at changes in the skin cells as a result of UV stimulation. Then they gave them pycnogenol for 12 weeks, and they repeated the process here with UV stimulation, and then they took a biopsy and checked the changes resulting. And they were looking at predominantly at what happens related to pigment generation, melanin generation. And there's been a lot of research in this area, and it's now known that it's not just tyrosinase. There are other enzymes that are needed to support the activity of tyrosinase and stabilize that enzyme itself, and then also enzymes that are needed to produce the vesicles to store. These lysosomes are vesicles to store the pigment once it is produced before it is released. So looking at this study here, you can see before taking pycnogenol, UV stimulation very significantly increased the genetic expression of the tyrosinase enzyme. However, after taking pycnogenol for 12 weeks and irradiating them, stimulating them with UV, you could see that there was some increase, but pycnogenol was able to decrease genetic expression compared to baseline by greater than 50%. So decreasing the amount of tyrosinase enzyme around to produce the pigment, even with UV stimulation. And similar effects were seen on other enzymes that support and stabilize tyrosinase. So in this case, this is MITF, which helps to stabilize the tyrosinase enzyme in its activity. And you could see pycnogenol decreased the genetic expression of this after UV stimulation by nearly 70%. And also TRP1, which again is another stabilizer supporter of tyrosinase, was inhibited, the genetic expression was inhibited by 75% here. And then part 1, which produces the vesicles to store melanin in the melanocytes. This again, genetic expression decreased by almost 70% with taking pycnogenol. So much more detail into the mechanism of action and how pycnogenol has this whitening effect. And across the board, you're seeing significant reduction. Even though they're stimulated by UV radiation, pycnogenol is helping to decrease the amount of tyrosinase activity and decrease melanin release into the skin. And then this same group conducted another study a few years previous to that one, where they, again, looking at a similar population group, healthy menopausal women, and they again were taking 75 milligrams of pycnogenol per day. In this study, they were looking at skin surface parameters such as hydration and elasticity, the appearance of fine wrinkles, the density of the skin. And then they were also, they did biopsies at the start before taking pycnogenol, and then again after 12 weeks of taking pycnogenol to look at collagen synthesis and hyaluronic acid synthesis. So after taking pycnogenol for 12 weeks, you could see that there was a very significant plus 44% increase in the genetic expression of the hyaluronase or hyaluronic acid synthase enzyme. So with more of the enzyme around to produce more hyaluronic acid, you would expect that the hydration or the moisture content of the skin would significantly improve. And that's exactly what happened. Particularly in the dry skin group had the best response. Overall, at the end of 12 weeks, more than 21% improvement in hydration. But you could see overall, even at the end of 12 weeks, there was still, across the whole group, a positive plus 16% improvement in hydration with taking just pycnogenol. And then looking at collagen expression here, you could see that the genetic expression of type 1 collagen, most abundant in the skin, increased by 40% here. And so you would expect this to have benefits for improving elasticity and decreasing the appearance of wrinkles, etc. And measurements using a cutometer, which measures the rebound of a puff of air against the skin and checks elasticity. You could see that what they call the most important parameters of the cutometer, the R2 and R1, there was R7, I'm sorry, a significant increase which was maintained throughout the 12 weeks of the study. So significant improvement in measures of skin elasticity here. And then another same cutometer used to measure what they call skin fatigue. And you could see that there was a significant reduction in skin fatigue in this population as well. And then lastly, net elasticity was significantly boosted by the end of the study by a maximum 25% here across the board. So, and along with this, I didn't present it in the slides, but there was a significant reduction in the appearance of fine wrinkles in the study and a significant improvement in the density of the skin. So definite anti-aging effect, especially considering the population is between 55 and 68 years old. So very nice benefits we're seeing here. And then pycnogenol has also been studied in complex formulations with other key targeted nutrients to improve skin health. And the study that I'm about to explain was conducted using this product here, the Avel product that was developed by Pharma Nord. Now, this is a very evidence-based, science-based formulation here with key nutrients that are needed to promote healthy skin production and turnover, such as vitamin C, which is, of course, needed for producing collagen itself, vitamin E and the carotenoids of vitamin A, important for maintaining healthy skin, reducing free radical stress in the skin, biotin, to help reduce the skin disorders or the risk of these skin disorders. Selenium to boost the antioxidant capacity, as well as zinc for skin cell turnover. And they use something called the biomarine complex as well, which is a shark extract which contains the collagen in there and glycosaminoglycans. Silicate, I should say, from horsetail extract. And then their type of selenium that they use is one that's called selenoprecise, and this is organically bound selenium, and this is to significantly increase the bioavailability of the selenium. And this, of course, is necessary to significantly boost glutathione in the skin for health and antioxidant protection. And then it also includes blueberry extract or bilberry extract, and then pycnogenol as one of the key ingredients. In this formulation, pycnogenol was a key active ingredient with 40 milligrams per day combined with the other ingredients. So the study itself, a well-designed study, a double-blind placebo-controlled trial in 58 healthy women, aged between 45 and 73. So you could already expect some signs of aging in this population. And they took 4 tablets of Avel for 12 weeks, or there was a control group which took identical placebo tablets. And the outcomes, so they were looking first at skin elasticity and skin texture. And to do so, they used the cutometer again, similar to the machine used in the study I just explained, and then a microtopography imaging system called Primos, for more in-depth topical microtopographical view of the skin. And the skin area investigated was on the underside of the left forearm, and no skin products were allowed to be used on that area. And the measurements were always made under standard controlled conditions. So here's the main result, focusing on elasticity. You could see that already in just 6 weeks, there was a significant increase in elasticity of the skin by 9% using this formulation, whereas with placebo, there was no significant change. So improving elasticity with as little as 40 milligrams of pycnogenol a day combined with these other targeted ingredients. And then looking at the 3D view, the topography of the skin, there was a significant reduction in the appearance of fine wrinkles in the volunteers in this study as a result of consuming the A4M product. It's a little bit difficult to see by this image, but there was a significant reduction in the appearance of fine wrinkles. And you can see here that there was a 6% increase in the roughness of the skin only in the placebo group, whereas in the A4M group, or the treatment group, there was no change at all. They were able to basically stop the changes that could increase skin roughness with taking the product of A4M. And then example from one subject, the microtopography view here. This is much more clear and more obvious. You can see here that there was definitely a significant increase in the smoothness of the skin in this one particular subject. So this is the target that we're aiming for, and again through an oral treatment with skin-targeted nutrients, not a topical treatment. And then the study is also published in the Journal of Dermatological Treatment back in 2004. This is also a peer-reviewed journal, and it is available on Medline for you to review yourself. So just in summary of this presentation today, the first half focusing more on cardiovascular and vascular health, improving significantly blood flow by enhancing the production of nitric oxide in the arteries. This, of course, having many benefits in different parts of the body. Combined with L-arginine, as in the Prelox combination, you can see significant improvement in mild to moderate ED in men. And inhibiting clotting or stabilizing the blood vessels to decrease, in the case of my talk earlier today, used as a treatment for chronic venous insufficiency, or in this talk here with improving the blood flow and the strength and integrity of the blood vessels of the eye, while also decreasing the risk of clotting, in this case, in this particular study, in the eye. And then the most groundbreaking work, in my opinion, has been related to stopping the progression of atherosclerosis with pycnogenol, particularly in combination with the Centella asiatica. But even with pycnogenol by itself, if you can start it early enough in the early stage atherosclerosis, you can expect to have a significant benefit in slowing down the progression of the disease. And even with more advanced atherosclerosis, taking pycnogenol at a bit of a higher dose can have a definite significant impact. And then, of course, combining it with Centella, the results were phenomenal in these very long, well-designed studies. And again, even though the studies went on for 3.5 years, there were no significant side effects that were reported with taking pycnogenol that long term. And the group with aspirin, there was no significant negative interaction that was reported there either, so the safety was quite good. And then related to skin health and beauty, the abundant amount of research related to pycnogenol by itself, and then also in a targeted evidence-based formulation as well, where you can see that you can reduce the amount of pycnogenol combined with targeted nutrition and still get similar benefits as are seen with pycnogenol in a higher dose by itself. And again, these focus on enhancing the microcirculation, skin perfusion, better oxygen nutrient delivery, better waste removal in the skin, reduce negative effects of UV damage, particularly important in this part of the world. And as a result of this, also decreasing pigment generation that may be stimulated by UV exposure. Pycnogenol inhibiting tyrosinase, inhibiting melanin production. And then also, even pycnogenol just by itself, significantly stimulating collagen production and enhancing genetic expression of the hyaluronic acid synthase enzyme, therefore boosting hyaluronic acid production, providing significant increase in moisture content in the skin. So a lot of actions that we're seeing here with pycnogenol. And again, just to remind you all that the pycnogenol.com website is available here in Thailand, in Thai. It's actually available in 11 different languages, so you can pick and choose which one you want to read. And on the website, there's a section that has brochures that are broken down by health category or condition. And all of these brochures are translated into these languages as well, and they're in PDF format for anyone to download and review. The references are included in the PDFs there, and so if you want a specific one, then you can contact us at HORFAG and we may be able to share the reference with you. But that's the end of my talk. So I'd be happy to answer any questions if time allows, and thank you very much for your kind attention.
Anyone has any questions?
Just now you mentioned that these pycnogenol, they can reduce the melanin productions.
Yes.
How about for those who already have pigments? Do they have reduced?
Yes, well, the study that I showed was actually women who had melasma, which is a bit of a different source of why the pigment occurred, but they already had identifiable skin spots. And then they took pycnogenol and saw a significant reduction in the size of the skin spots and a significant lightening in the color and the appearance of the skin spots. So yes, again, skin turnover is a process, generally 28 to 60 days depending on your age. So it may take some time to see a significant change in the color and the appearance, but yes, we have seen that with pycnogenol. Thank you for your question.
Since there are many products that contain pycnogenol, and why should I buy from Pharmanon? Is there?
Very good question. Excellent. Well, I am not an employee of Pharmanord, so I won't speak exactly to that, but I can say, Pharmanord is a well-respected pharmaceutical company. So the standards in producing the products are the highest that you can expect. And again, it's a European-based pharmaceutical company. All the products are produced in Denmark and shipped here as finished products. So I know this part of the world has unique conditions with the high temperature, humidity, things like this. So oftentimes, individually just bottled supplements, you can have degradation of the product where they stick together and things like this. The product breaks down much faster. Well, the Avil products are all blister packed, as a pharmaceutical product would be packaged. So in that sense, you could expect the highest quality from the Pharmanord product. But you are right, there are many different pycnogenol products, more than 700 in the world. But if you want the best quality, choosing from a well-respected pharmaceutical company is a good place to choose from. Thank you for your question.
All right, please give another round of applause to Dr. Jeffry Strong.
Thank you very much. ありがとうございます。